Good morning or good afternoon, depending on where you're joining us from today. Welcome to Lessons and Reflections from Family-Centered Community Change. I'm Burgundy Allison. I am a program associate with the Annie E. Casey Foundation's Center for Civic Sites and Community Change. I'll be moderating our webinar for you today. Our agenda includes directions on communicating during the webinar, the vision of family-centered community change, the FCCC evaluation and FCCC in practice dialogue, integrating efforts and achieving community change, panel discussion with our leaders of the communities that the foundation joined, lessons for the future. We will answer your questions and provide resources for learning more. Our presenters for the day include 3 of our partners from the communities that the foundation joined and 3 of our evaluation partners. I'm joined by Lakeisha Bragg of United Way of San Antonio, Kenya Peoples from Buffalo Promise Neighborhood, Marla McDaniel of the Urban Institute, Chastity Edwards of Community Properties of Ohio Impact Corporation, Teresa Anderson of the Urban Institute, and Amelia Coffey of the Urban Institute. Communicating with us during the webinar is as easy as the chat or Q&A window that's in the lower right corner of your screen. You can type questions for the panel at any time during the webinar. There's no need for you to wait until the end. The webinar is being recorded and will be available later at the Annie E. Casey website. Now let's dig in. What was the FCCC vision? The Annie E. Casey Foundation developed solutions to build a brighter future for children, families, and communities. For family-centered community change, the foundation joined 3 partnerships, providing technical assistance, trainings, and peer learning opportunities to strengthen 2-gen approaches and race equity in Buffalo, New York, Columbus, Ohio, San Antonio, Texas. So what are 2-generation approaches? 2-generation approaches aim to address the needs of parents and their children simultaneously. They're designed to help families achieve financial stability and for children to develop well. These approaches achieve this through job training and financial coaching with the parents and early childhood education for the children. There's integration of programs, staff, and data, and there was an increasing focus on equity. Now we will get into the FCCC evaluation and what FCCC looked like in practice, and my esteemed colleague Marla McDaniel will give us that information.
Thank you, Burgundy. Hi, everyone. My name is Marla McDaniel, and I'm one of the principal investigators of the study, one of just a larger number of our research team. You're going to meet 2 other members of our team in this presentation. But just to give you a brief overview, the Urban Institute evaluation was a co-designed designed evaluation with the communities. We worked very closely on designing a longitudinal in-depth implementation study and process study, and also a descriptive cost study. Our evaluation started in 2013, and it actually ended at the end of 2019, right before the pandemic. Our data sources included interviews and focus groups with program staff and administrators and participants. We also had program data on participant and family characteristics and program activities. And then we also conducted a descriptive cost study, and we were able to capture the cost of staff time spent on FCCC-related activities. I'm going to turn it over to my colleague, Amelia Coffey, who's going to give a little bit more detail about the 3 communities.
Thanks, Marla. I'm Amelia Coffey from the Urban Institute. As Burgundy mentioned a little while ago, the 3 communities were in Buffalo, New York, Columbus, Ohio, and San Antonio, Texas. And as you can see on this slide, they varied somewhat in terms of the number of families they served and the demographics of those families. And you see here that they also varied somewhat in terms of the percentage of families they served in a high-touch capacity, and we define that as having received at least 5 sessions from an FCCC coach. And you'll hear in just a little bit from our community partners what those coaching interventions look like. Next slide, please. And now Kenya Peoples. Peoples from Buffalo Promise neighborhood is going to tell us a little bit about what FCCC was building on within the Buffalo community when it started, as well as what the FCCC intervention looked like in Buffalo for families, and how the two-generation strategies furthered this approach.
Hello, everyone. Yes, my name is Kenya Peoples. I am the financial coach for Buffalo Promise neighborhood. When we initially started, we started back with one school back in 1993. It was one of the worst performing schools in the city of Buffalo. And at that time, I am an employee of M&T Bank. M&T adopted the school and made a major investment in turning this one school around. Fast forward 20 years, what M&T did is they applied for a Buffalo Promise, well, they applied for a Promise Neighborhood grant, which was similar to the Harlem Children's Zone. And we was awarded that grant. And with being awarded that grant, now we decided on ways that we could best impact the community. After that, we applied for an NEE Casey Foundation Partner Grant, and that is the FCCC investment into the community. So when we got that investment into the community, what we did was we took our schools. We have four schools in our footprint. We have 2 earlyhood child centers and 2 actual grammar schools. And what we did was we infused different programs into those education centers. So we put financial coaching in, because we understand as parents financially do better, they will pass those goals or those gems down to their children. We also focused on schooling and education to make sure that the parents were able to go back to school, get better jobs, get higher paying jobs, and things of that nature. And lastly, we focused on the children. We had a parents as teacher specialists, and what that parents as teacher specialist did was work one-on-one with parents for them being their child's first teacher. So that actually ran into what the interventions look like. Those were our 3 interventions. We focused on financial, we focused on career, and we focused on children. The 2Gen furthered our strategies in this capacity. Prior to the 2Gen approach, everything was in silos. So we had programs that only worked with children. We had programs that only worked with adults. But when we incorporated 2Gen, we married everything. So me as a financial coach, I was entwined with what's going on with the children in class, as well as what's going on with the parent, and I could mirror those things. Prior to being a financial coach for Buffalo Promise neighborhood, I was the parents and teachers specialist. So what I did in that capacity, I worked on different techniques to have parents and children interact to get the best bang for the parent and the child. I think that about sums it up.
Great, thank you so much, Kenya. And now we'll hear from Chastity Edwards in Columbus. So Chastity, what was going on? What was FCCC building on within your community when it started? What did the intervention look like? And how would you say that 2-generation strategies furthered that?
Sure. Hi, Amelia, and everyone. FCCC was building on work that was really starting to gain momentum amongst a group of community stakeholders where the FCCC investment was made. It was a neighborhood that was rapidly gentrifying after being taken over from university partners by Community Properties of Ohio. The group of stakeholders included a local foundation, university partners, neighborhood members, and several other stakeholders in terms of community development. So they were trying to ensure that development was occurring responsibly and with respect for the original residents in the neighborhood, which attracted the attention of the Casey Foundation and led to the ultimate FCCC investment. In terms of our intervention for families, Community Properties of Ohio has a two-generation approach as its mission. So we chose to implement a family coaching model whereby we enlisted or recruited community members to come in for intensive coaching on a number of different sectors in life. So they had opportunities to engage in financial coaching or to set goals around continuing education. And with support, we tried to help families set goals for their entire family, which allowed us to then really add some momentum to that two-generation approach. As a result of that, we partnered with a local elementary school where we have about 300 housing units in that same neighborhood where the FCCC investment was made. And that gave us access to that next generation for our two-generation approach. In terms of intervention with our students, we partnered really closely with school staff in order to identify kids who could potentially benefit from wraparound services and or interventions. By looking at early warning indicator data such as attendance, we were able to identify kids whose families were struggling with housing insecurity or food insecurity, employment issues, or transportation issues. And that allowed us to work together as a collaborative to connect families and do more handoffs to other resources with our FCCC partners. The two-generation strategy furthered this method in that we were able to establish solid partnerships by way of data sharing agreements and other collaborations to ensure that we had the appropriate level of service in place to truly meet the needs of families where they were.
Thank you so much. And now we are going to turn to Lakeisha in San Antonio. So Lakeisha, what was going on with FCCC? What were you building on within your community when it started? What did the intervention look like? And how did two-gen strategies further that?
So, good morning, everyone. Thank you for having me. I'm Lakeisha Bragg. I am the Systems Director for our Dual Generation Initiative. Prior to this role, I think it's important that I speak and state that I was a frontline staff, program manager, and family coach for the parents that made up our local initiative. I would say that the FCCC was building on our Eastside Promise grant. Here locally in San Antonio, we had a community change effort that was happening with our Eastside Promise neighborhood grant that was a cradle to career continuum of solutions and intentional about improving educational and economic developments here locally. Our EPN grant focused on working with community organizations, local businesses, and community members to provide wraparound services to improve the results for our neighborhood children and our families. Eastside Promise was building on a strategy to address like struggling schools, unemployment, poor housing, health and wellness, and our crimes in our neighborhood. So I would say FCCC came in and provided the information and infrastructure on what a two-generation approach in servicing a whole family looked like, which is how United Way began to approach different organizations across multiple sectors to come together to build and develop the dual generation collaborative. We were able to expand our target area because our Eastside Promise neighborhood consisted of 3 zip codes. So we expanded and was able to serve 10 zip codes and make up the full Eastside Promise zone. So at a collaborative level, I would say We did had a partnership that consisted of early childhood partners, workforce development, housing, and financial services that began working together to provide services in that particular targeted area to serve the child and the parent together, whole family. It became a multi-partner collaboration with one shared result, which was to increase the stability of the family with a child that aged 0 to 10 years old. I would say this evidence-based model pretty much deepened and enhanced the work within our community here locally, and it increased the quality of how we served a family. More individual work of goal setting with parents and intensive case coaching, as well as working toward improving the quality of childcare centers. It also resulted into us being co-located to provide these services. And I would say the strategies also promoted system changes here throughout our city, with many organizations beginning to embed the 2GEN model in their work, and also how they collect, share data, tell stories of parents, and also how they begin to think about how they can involve parents in their decision-making processes.
Thanks so much, Lakeisha, and all three of our community partners.
Amelia, I'm sorry. We have a question from an attendee that seems particularly salient for this section. And the question is, of the three community leaders that are with us, what do the FCCC communities, what do you feel are the key operational capacities necessary to successfully implement a 2GEN or dual gen approach?
I would say that one of the main things would be to make sure that the collection of partners know their roles and responsibilities within the collective, and understand that it is a collective, and in order to improve whole family, you have to work together, and it cannot be done siloed. I think when they say that it takes a village, I think it really does take a village to move the needle and service families.
Lakeisha, I would agree with that. And I would also say have a distinct target on, the community that you want to work with, so that you're not spread too thin. And also be willing to change and adjust on the fly, because what's important in a community on Thursday may not be important to that same community on Friday. So you have to be agile when working in these fields, and be able to give the families and the participants that you're working with what they need when they need it.
And I would add to that, in terms of operations, having a really strong infrastructure to support your data collection and analysis, having people who are really savvy and can understand how to translate those qualitative data points into something quantitative when it makes sense, and having a good sense of how to blend narrative with those quantitative data points to tell the story.
Thank you.
I would just also add to the importance of having a strong backbone organization to also assist with leading the work. I think that was one of the key factors that helped dual generation here in San Antonio.
Absolutely. Thank you all for that great input. And now I think we can turn it over to my colleague, Teresa, who will talk about integrating efforts and achieving community change.
Great, thank you, Amelia, and thank you so much to the panelists. That was a wonderful discussion, and I look forward to hearing more about it in a moment. But I am very excited to share some of the findings and lessons from the evaluation. So first, this will be some findings, and later we'll get into some lessons. One thing I want to highlight as we're summarizing is just that it's important to acknowledge that this was an evolutionary effort. The FCCC grants went on for a long time, and we're trying to summarize a lot of work and a lot of effort over that long period. So some of this is necessarily overly concise, but I think hopefully it reflects some useful lessons and takeaways for folks. So to start, I want to describe this figure was originally produced by the Annie Casey Foundation as a conceptualization of what integrated two-generation services might look like. And the foundation organized this idea into 3 pillars: family economic success strategies, including workforce and career development, access to income and work support benefits, and financial coaching and education. And the second pillar was capacity building for parents, caregivers, and agencies, including accessible resources and partners to engage families, support for parent advocacy and networks, strategies to address family stress and trauma, and culturally competent staff. And then finally, the third pillar, early care education and quality experiences for children, including high quality early education programs, successful transitions to elementary school, and high quality elementary school experiences. And I think one thing that's useful to highlight is that this two-generation strategy that the Casey Foundation funded was broke with the previous norm of focusing only on very young children, and instead the investment was targeted to children up to age 10. So that brought in another dynamic around elementary education and slightly older children. So that was important as we were thinking about this. And then finally, there's a cross-cutting effort around influencing policy and systems. So in our work, you can go to the next slide, we first looked at kind of what FCCC achieved across that Casey framework. And one of the big takeaways is that it's very challenging to provide strong complementary interventions in all 3 of these areas, especially because so much of the work was focused on meeting community members where they were and prioritizing their own individual and family goals, which may not have 100% aligned with all 3 elements of this type of framework. That said, there was a lot of progress and developments on all 3. So starting with economic success, family economic success strategies, we did see all 3 communities offering job and employment services that were targeted to adults' goals. One thing that was less clear to us, just because the data were harder to track, it wasn't totally consistent, is whether the job opportunities that adults connected to were on the pathway to stable, family supporting, fulfilling careers. A lot of the folks were working more towards stable entry-level type jobs, but we weren't always clear about whether those were career pathway jobs. The second was that the coaches connected families with income and work support benefits. The coaches were really critical in that role, but the role and the relationship of the coaches varied by coach and by individual. Some coaches focused more on developing self and community advocacy skills. Others focused more on barrier remediation or helping facilitate service access. And there was differences among the communities in the intensity and the reach of family coaching, with a higher intensity and coverage in San Antonio and Columbus than in Buffalo. And then Buffalo and San Antonio offered consistent financial coaching. That didn't manifest consistently in Columbus, but we saw 2 of the communities offering that service regularly to families. And the middle pillar here, capacity building for parents, caregivers, and agencies. We saw that the communities partially met capacity building goals through family coaching and peer groups, but as I noted, attendance and content varied. Each of the communities really took an approach that was tailored to the expertise of the partners and the interests of the community members, so there were some differences there. And the mental health resources and staff cultural competence was somewhat uneven. So only Buffalo had explicit mental health resources for adults, and only Columbus had those resources for children. But I will say that the cultural competency of the coaching staff was generally very high, and they were very well tuned in with the community members and their needs. And then the third pillar here, early care education and quality experiences. We saw that targeted interventions for individual children enrolled in FCCC were limited. It was more that across all three communities, the children may have been more likely to get quality education and care because they focused, the partnerships focused on capacity building in the communities around access to high quality education and care settings. We also looked at not just these three pillars, how they stand, but also how adult and child services were brought together across generations. So it was really across all three communities. And again, this emerged as a common strategy, but wasn't something that was necessarily prescribed at the outset. But that coaching was really the primary glue among services for families. The coaches were the main touch point where adults could get help in addressing family needs and leveraging opportunities for themselves and their children. And we also saw that many adults set a 2-generational goal, which meant it was either a family goal or one goal set for the parent and one for the child with those coaches to try to improve family well-being. The communities also brought 2-generation awareness to existing child and adult services and saw some kind of culture shift in organizational focus through that emphasis. We also observed that the partnerships that were developed laced together a complementary set of family services for community members in a way that could meet varying family interests and needs. And one really thing that evolved over time was the co-location of services and creating common intake procedures, which really smoothed a lot of barriers to access when community service providers were in the same physical space, which allowed both easier access for families and easier collaboration among partners, as well as making those entry processes easier. But there were still some services that were scattered or not as well aligned in either time or location, so it wasn't always possible for families to take advantage of all of the offerings for their goals. But there were quite a few services that were in the same space. So overall, our takeaway on that is that there were still opportunities to create even more integrated family-focused experience for community members in all three locations. And so we're really excited to see what that looks like as we think about the future and what that's going to mean. So another question we asked was, did the partners get to a meaningful community change? It's interesting because what does community change mean is, of course, the first question you're going to ask. And the Annie and Casey Foundation saw community change as a product of the existing comprehensive community initiatives that existed in each partnership location, which they envisioned the Casey Foundation envisioned would be enhanced with the 2-generation framework and this foundation's strategic co-investor role. They didn't necessarily expect population indicators to change at this time. They didn't expect poverty to have major shifts or other indicators to be majorly changed with this investment in this time period. And the truth is that all three communities did see dramatic change over the 7-year period, but a lot of that was because of infrastructure, demographic, and policy shifts, the transition of federal, state, and local leadership, and all three communities also saw continued gentrification pressures that led to changes in demographics of community members. So there were a lot of change. What we can attribute to FCCC on that level is hard, but we can say that there was a legacy of this work that was left behind in all three communities and will be continue to be left behind and continue to evolve as they continue their efforts. So one of the big legacies was the new and strengthened connections with schools and early childhood education providers across all three partnerships. The second was establishing that mutual commitment among organizations to focus on families that were living in the communities. And finally, developing new partnerships and new commitments that might leverage additional opportunities for future work to support families across these locations. So with that, I will pass this to Burgundy, who is going to discuss and lead a discussion about community partnership and leadership. So thank you so much.
Thank you, Teresa. So Chastity, Lakeisha, and Kenya are now going to join me in conversation about their experiences implementing FCCC. And first, just thank you for joining us. And so though your formal partnership with the Casey Foundation is winding down, you are still continuing the work. And so we really appreciate you taking the time and are eager to hear your perspective. The first question I'm going to ask of Chastity and Kenya: what values are key to sustain when implementing family-centered community change? We heard a question asking about the operational capacity to implement And we talked a lot about sustainability and winding down the partnership and the investment, but what are the values that are germane to implementing family-centered community change and need to be sustained?
I would say relationships are paramount in this type of work. It is very personal, if not intimate, where families are concerned. And it takes time to build a trusting relationship with a community stakeholder, to really be vulnerable and open with regard to what the issues and needs are, so that we can evaluate how to effectively meet those needs, and be honest about where we cannot, or what the barriers are, and thinking of strategies to overcome said barriers. Transparency is paramount to building trust and relationships. So really being open and honest, not just with families, but among partners. And sometimes that means having accountability conversations, or crucial conversations, as we like to call them. So navigating those relational waters really takes time and effort, and strategy, quite frankly, but cannot be underestimated.
Yeah, I would have to agree with Chastity. The first thing that came to mind when you asked this question was trust. I think trust is a key factor when you're talking about implementing family community centered change. The work is very intimate for the families, and they have to have that trust to be vulnerable with you about some of the things that they are insecure about in their own self. So I believe more than anything, yeah, trust is probably the most important key to the work.
Thank you. The next question, I'd like to hear from Lakeisha in Kenya about how significant the expertise of frontline staff was to the development of your community's approach to this work.
Lakeisha, I can go if you don't mind.
Oh, go ahead. I'll piggy off of you. That's fine.
Okay, no problem. So, expertise of staff. So, I believe that aside from the financial investment, the frontline staff is probably the most important part of developing this community approach. Frontline staff, they're your gatekeepers. They're the face of your organization. They are who the people know. They are who your families connect with. And if that chain is broken, then it's difficult to even move forward at all. A lot of times you hear the saying that if they build it, people will come, but you need people to work with the people that come. And if you don't have the proper staff in place to do that, the whole initiative can implode in on itself. So just in closing, I believe that frontline staff is probably one of the greatest and most important thing in doing this work if you want it to be successful.
And to add to that, I would say I think that one of the significant pieces to frontline staff that I've seen and I've witnessed is that the frontline staff are the most relatable to the families in the community to which they serve. A lot of times the frontline staff members come from that particular community, so they're very familiar about the resources that these families are needing. Again, like Kenyon said, frontline staff are the gatekeepers. So they're the ones that are working one-on-one with these families, addressing these barriers, setting these goals, finding out exactly what these families have went through, what it is that these families are needing, what it is that these families are trying to achieve, and walking alongside them to develop these resources to assist them. They are the ones that the families tend to trust the most. And a lot of times you will continue to hear the word trust. a lot of these communities, I know particularly here in San Antonio, trust was very minimal. So it took a long time for us to come in and be able to build that trust within these neighborhoods. And majority of the time, that trust starts with the frontline staff and the relationship building that the frontline staff develops with these families.
Lakeisha and Kenya, Chastity, feel free to chime in as well. There's a question from the audience about the professionalization of frontline staff. Were they in professional positions? Was there a certain level of education necessary for the role, or were the roles peers? Were they actual community members who had been trained to be able to work with residents in the community for this particular approach?
I would say here locally, it consisted of both. So it was a mixture. So you may have had peers, you may have had previous parents or whatnot that have been, you know, had the experience of the benefits and the government assistance and things like that. And then you may have had frontline staff that had the educational experience and expertise. So I would definitely say it was a mixture.
Kenya or Chastity, any follow-up to that?
Sure. The family coaches in Columbus, the majority had a background in social work. So that was incredibly useful in terms of connecting families with resources and being able to provide the level of sort of mental and emotional support that was required for the intensive coaching. For school-based staff, we did look for people who had education experience so that we could help families specifically navigate the educational territory.
And to also add to that, I would say locally, we also had a lot of coaching trainings. So therefore, our frontline staff will speak a common language and know how to address barriers within these families. So I would say that coaching training helped a lot when we did the peer-to-peer mock trainings and things of that nature as well.
Thank you. The next question is for all three of you. In your communities, what were the common barriers that families experienced on their journeys to be better off?
So, besides the obvious, like transportation and access to services, I believe one of the barriers, and every panelist spoke about it, was trust or lack thereof. When we speak about barriers, one of the things that happens for our families is the ability to be able to trust. They're making themselves vulnerable. They're giving you information about their kids. They're giving you information about their finances. They're giving you information about maybe some situations that they're not so proud to talk about. And being able to trust was one of the common barriers that I know for us in Buffalo that we had to work around in order to start the good work. We couldn't start the good work until we were able to have families trust us and able for us to trust them as well, because they're unpacking a lot. So sometimes you just need to be able to trust. In our particular neighborhood, for example, it's usually we're getting programmed a lot. You know, they're throwing different programs, you know, different research companies are whatever the think tank thing for today is, they're going to throw it in this community and see if it works. But what happens on the back end is they do nothing after it. So they come in with a program to help children succeed. They work on it for 6 months to a year. Children are invested. and after the research is done, nothing else takes place with that investment. So parents became used to it. And what they would do is they would step in, get what they can get, and step out because they figured that's what whoever the research tank was going to do, they were going to do the same thing. So more than anything for us, I believe trust and being able to have your families trust you and knowing that you're going to be there in the good times and the bad times.
And I would add that we also have to understand that I'm echoing, I'm sorry. We also have to understand we're dealing with communities that have experienced generational poverty. So it's some of the common barriers that I noticed that we had to work with from the very beginning was instilling the motivation within these families. So we had to do a lot of, I say, training the brain to think different, to know that these services are really, really here to help and assist you. That we got a lot of times where families say, well, I'm just a number to these organizations. So it's working with them and providing that motivation, that self-esteem, and that reassuring, because these are parents that are coming from backgrounds where they're looked at as if they're nothing or they're less than. So it's trying to remove that barrier to build up that self-esteem within them, to let them know and have them think different. So I would say lack of motivation, determination, and sometimes willpower was a common barrier that these families experienced. And then two, another point, sometimes they don't know how to handle failure. So when they take one step forward, they're proud of that step. But when they take two steps back, it's like you are starting all over again to try to reteach them that failure is okay. Just you may fall, you just have to get back up. So it's a lot of motivational talking through with these families as well.
I would add just life. As FCCC members, we show up every day with our mindset to the goals that we're setting with families. And they have their whole lives that they're dealing with every single day. And so those goals may not be at the top of their agenda every time we get together or when we expect to get together. So despite the agenda that we may have set together, there's a lot of other things going on with people that just take precedent or get in the way, and sometimes even pose distractions to what we together said we wanted to accomplish. So we have to be patient as people move through day-to-day living circumstances.
And there's one more critical piece, and I'm surprised neither one of us have said this. I think one of the biggest barriers is childcare. A lot of times when families don't have that childcare, they're unable to work, they're unable to continue a career path. So until you can get that childcare under control, then that is when these families are really able to focus on completing some of these goals.
Thank you. Our last question, how did your work shift during the pandemic? And will any of the changes that you made be permanent?
In Columbus, our work really shifted away from capacity building and more towards making sure that basic needs were met. For the school-based work, it meant ensuring that students had the technology that they needed to remain engaged before we could even talk about engagement. And that meant ensuring that the family had internet and they had a space to work. I know with family coaching, the same was true. We're in a food desert, and that food desert is now wiped out during the pandemic. So we have to make sure that we understand what resources are available as we're working with families so that the work is relevant. In March of last year, we really weren't interested in whether or not you wanted to continue your education. We had to make sure that your lights were on and that you had resources to prevent eviction. So that was quite a shift. In terms of changes that may be permanent, I think that we definitely found value in the digital connection, the platforms that we relied on to remain connected. There's a level of convenience that's involved with that, even if it's not as personal in the beginning, and a different level of outreach that we're able to accomplish by employing those platforms.
I would totally agree with what Chastity said. Here locally, when we meet with clients, it was on a monthly basis, and it was for the most part face-to-face. The families enjoyed that. We enjoyed that. We had monthly family celebrations that were face-to-face. So during the pandemic, all that had to shift, and then we had to move virtually, which was a big change for not only us, with staff. It was a big shift for our families, which they were not used to. We had to do a lot of coaching and teaching them how to use a Zoom link, download the Zoom app, work virtually, working through how to have patience when dealing with your children while they are at home trying to do their virtual schooling. So here you have parents that are struggling educational from an education standpoint for themselves, trying to be a teacher to their children. That was a struggle. It created a lot of stress for our families. So again, like Chastity said, shifting from how do you focus on your particular education to how are you dealing with your kids today? How are you dealing with yourself? How's life? That basic needs, and just that continuing to tell these parents how to give themselves positive self-talk to keep that stress level down. And will these changes be permanent? I think some of them will. We will be try to continue working with these families both virtually and in person, whichever they prefer. We have a lot of organizations here in San Antonio that are trying to improve the digital divide and the hotspots around these different buildings and organizations, so these families can utilize the Wi-Fi service, because that was the problem. A lot of families didn't have internet. They were trying to, use the log on to their classes from their cell phones. So it's trying to figure out how we can assist with purchasing laptops. So we had to shift all that during the pandemic. So those are some of the changes that will be permanent.
Just to echo what Lakeisha and Chastity said, one of the first things that we did here in Buffalo was we just contacted every one of our families who was on our roll and let them know we were here. Just that. We didn't program them. We didn't ask them for information. We just basically wanted to let them know we were here. And I think that's spoke volumes to the families, just letting them know, because nobody knew what was going on back in March. So that shifted the work, because what we decided to do was take a more community approach, where it wasn't about, are you working on going to get a job? Are you trying to get your finances? No, we're here, basic. Do you have enough food? Are you imminent for eviction? Things like that. So we fielded so many calls about that. I believe that change for us is permanent, because what it did for us, it allowed people to see us in a different light in the community. And I think they respected it a lot more.
Thank you. That was our last question, and just so grateful for all of your perspectives, and just want to elevate that what we've heard reverberated over and over again from you, and even in earlier data where coaching was kind of the glue that held things together, is the trust and the relational aspects of this work. And so thank you for being trustworthy and for really being nurturing those relationships with community so that this work could continue. I'm going to hand back now to Teresa, who's going to give us some lessons for future work.
Thank you so much, Burgundy, and thank you again to our panelists. So to jump in on some of the lessons, the first is, and I would say there are going to be 3 slides of lessons, so be prepared, but hopefully they're all very exciting, interesting, and useful. So the first lesson, though, is about responding to new challenges. So as we might all know, a lot of big social changes have taken place in the last few years, and our evaluation period ended in 2019, as Marla noted. So as we're thinking about the social pressures of 2020 and 2021, and as these pressures continue, and even after they are over, service providers and other stakeholders will want to continue to consider a purposeful approach to deal with social recovery and the process and how to process continued trauma rather than going back to business as usual. I don't think we're ever going back to what the world looked like 2 or 3 years ago. The second is about understanding context. So people going into community-focused work need to understand that they are need to ensure that they are well attuned to community-level factors that affect families' opportunities and their constraints. So transportation, housing, job opportunities, all of these things. Local residents and long-established community-serving organizations are often experts on many of those contextual factors, and they can provide important insights alongside what we'd recommend a kind of traditional scan of community data indicators, which in itself doesn't always happen. So both of those together, the local knowledge and a scan of indicators, would be really valuable in future work. The third is about incorporating a broader understanding of equity. So incorporating a racial and ethnic equity framework is an essential element to creating new and sustainable economic opportunities in areas that have a large number of Black and Brown families. So going beyond local context to understand and mitigate the continued effects of racism and exclusion for families will help advance meaningful community change. The fourth lesson is about defining the framework and goals. So identifying key concepts and goals at the outset will help orient future work. Also, just because services are glued together for children and adults doesn't mean that they necessarily make sense as a system for supporting families. And similarly, specifying the goals of community change will help partnerships understand at the beginning what kind of impact they're trying to make. So setting out that framework for 2-generation initiatives that includes not only the types of services, but the nature of the glue that's going to bring them together and how that's supposed to affect community well-being in the long run can improve coherency in family experiences and leave a larger lasting impact. The next lesson is about ensuring racial and ethnic inclusion. So structural racism and racial and ethnic exclusion are deeply embedded in low-income service delivery nationally. Often white decision makers determine what communities of color need and how to provide it, giving low-income families just enough to kind of scrape ahead without sharing too much power. So disrupting racist paradigms requires real power sharing, where families and communities are included and centered in the development of strategies to break their own cycles of intergenerational poverty, and where they're given then the necessary resources and tools to take action on that, those strategies that are co-developed. This relates strongly to engaging partners at multiple levels. So this type of work has potential stakeholders at multiple organizational levels. So engaging both the policy and service ecosystem, the individual organizations and providers, as well as resident families in planning and design can allow for new and creative opportunities to emerge in this type of work. The last 2 lessons, next one is defining partnership dynamics. So when you're bringing all those organizations together, we can all appreciate that effective partnerships are complex but critical, and they take time to develop, often with trial and error. So specifying key elements of partnerships explicitly in a way that all partners are comfortable with, including funding relationships, organizational cultural alignment, development infrastructure, communications channels, and other dynamics. And that includes partners at all levels, including those community member partners that I mentioned. That will increase the chance of successful, sustained relationships among partners. And then finally, understanding impact. So documenting the effectiveness of an intervention helps inform meaningful change efforts and makes the case for continued investment of energy, time, and financial resources. We would say that those evaluation efforts should be sensitive to the issues raised here, including the context, the framework and goals, and how community members and the various partners can be appropriately respected and involved in the research process so the work is not extractive and advances equity. Thank you so much. I'll pass it back to Burgundy to facilitate the question and answer period.
Thank you, Teresa. And we are at the point where you can ask questions of our panelists, of our evaluation partners. So feel free to enter your questions in the chat.
And Burgundy, if you check your messages, you'll see there are a few questions already for you.
There they are. Okay, first question is, how did you guarantee that frontline staff had an opportunity to significantly contribute to the program's methods and goals? Often it seems like their expertise isn't honored in program development, and so the question really is what it looks like in different settings.
I can say for Columbus, one of the benefits was having smaller organizations. Community Properties of Ohio has a total staff of about 120, but our resident services department that was directly involved in the FCCC work hovered around 20 employees. So that gave frontline staff a great deal of proximity to both department and senior leadership, and a great deal of participation in terms of overall collaborative planning. And even when we were unpacking data, frontline staff were there to say, wait, I don't think that this accurately reflects what we were seeing or what we were hearing. So the proximity definitely gave frontline staff the power and the voice necessary to shape our programming.
And
Kenya or Lakeisha?
I would say the same happened here locally in San Antonio. So we have two separate tables that meet on a monthly basis. So we have a partner table, and then we have a frontline staff practitioner table that meets as well. So our practitioner and frontline staff members are able to be present at the partner table to listen and also be part of the whole conversations as well. So we do a lot of convening and collaborating on all systems. So you have CEOs part of the sitting at a table together with frontline staff members. So it is a diverse table or partnership or meetings that take place here locally as well. So.
Thank you. I have a question for our urban team. Can you say a bit more about how the research approach was co-produced? What did this look like, and what did it take to enable participants to shape the evaluation?
I can start off, and Amelia and Teresa definitely jump in. So I would say we didn't actually start off with as much of a collaborative frame when we went into the work initially. I think it grew over time. We had the benefit of working with the communities over a long period of time, long in evaluation terms. It really started with getting feedback on we were interested in understanding implementation of the program models, but we would often share the types of protocol questions and topics that we were interested in covering, get feedback on that. Are these some of the salient items that you guys are grappling with, and how can our evaluation help inform what you're doing? So there was that collaborative back and forth. Also working with the Annie Casey Foundation in this work, Casey convened the team. So there were several opportunities often throughout the year, to actually talk and discuss what we were hearing when we would go on site, what communities were experiencing. So in that way, it helped shape where we focused and where we plugged in the evaluation work. Amelia or Teresa, would you like to add any more?
Yeah, I would just add that I think that it's important to contextualize that we were sort of on this journey along with the foundation and the communities, over this 8-year period. And over that same period, there was really an evolution in the field of community engagement and evaluation, as well as sort of this awakening in many sectors of society, as everyone knows about, the importance of racial and ethnic equity and inclusion, and these processes and new priorities kind of evolved. And I think that there's been a lot of reflection, and we actually have an upcoming piece specifically dealing with community engaged methods in the evaluation, and a lot of that reflection in that piece will detail kind of how we felt that, or sort of came to realize that, in the future, it probably makes sense to have a more comprehensive and early sort of set of shared goals around engagement. But it was, again, just sort of early in that journey when all of this started. And I think that it was really a learning experience about how to integrate participant sort of feedback. So I would say we learned a lot, and it's a really great jumping off point for future evaluation work.
Yeah, and I'll just add one thing quickly, which is just a concrete example of where we did try to do things a little bit differently. So we did, as Marla mentioned, a descriptive cost study, which we didn't present the findings of in this webinar, but we have a blog post that report will be coming out, and then we have a blog post coming out shortly after that will describe some of the processes for how we developed that cost study. But it really was a much more iterative and engaged process of determining how to think about resources and how to measure those, and kind of what the goals are for the community's knowledge needs around kind of resource use and costs. So that was one place where we did try to do things a little bit differently than we had in the past.
There's a question about the key metrics that you use for activities and performance. Could you talk a bit about those?
Yeah, so it was interesting because there was another partner in the resource team that was actually working directly with the communities on performance measurement. That was Metis Associates. And so the urban team was more focused on this kind of evaluation and lessons, but the foundation certainly had some performance measurement goals. And so the Metis Associates was leading the communities with that. So I'm not sure if actually it'd be interesting for our community partners to reflect on the measures of progress and whether those were fair and appropriate from your point of view.
I can kind of speak to that. I would say that when it came to performance measures, one thing that and the Casey Foundation did not do as part of the partnership or the strategic co-investment partnership, they did not approach us as a community and pretty much try to tell us what measures we should set to serve our families. They actually granted us and allowed us to be able to talk about how we best serve our families. So it wasn't that they came in and they set these performance measures and say, these are the targets that your initiative is set to meet, and then we had to meet those specific targets. So it was pretty much listening to what we were saying that our community needed and what we were going to be able to provide to our families, and the performance measures were set that way. But we did have the report out to Metis on a I think we reported out every I didn't done so many evaluations, so every 6 months and annual basis we were presenting those performance measures.
Thank you. Our next question is, were there any institutional changes resulting from any of the projects in Buffalo, in San Antonio, in Columbus? Examples would be any changes in school systems or public assistance programs as a result of this work.
Yeah, I would say.
Go ahead, Lakeisha.
Okay. Here in San Antonio, I would say that with the help of the NEKC Foundation, we were able to increase the level of quality childcare services here locally. I think I spoke to how we were able to inform a lot of system changes within different organizations that are now taking on the two-generational approach. So you have our local workforce board that is incorporating two-generational models within their workforce system. We also have our local housing authority, our San Antonio Housing Authority, that is also taking the family coaching model and incorporating that into their practices and using that two-generation approach across their policies and systems changes.
I would say here in Buffalo, one of the big shifts that happened was maybe 10 years ago, the school board got rid of parent-teacher organization. They said that, I mean, they just weren't functional. So when we started, what we started doing was we started having parents come together, and for our charter school, what they did, they piggybacked off of that and started their own PTO.
In Columbus, the district has implemented a version of my role in several different buildings. So they've started to hire someone to coordinate and sort of oversee community partners within various school buildings. When I first started 4 years ago, there were several conversations about what all my role entailed and how it evolved and how it could still stand to evolve. So I haven't seen a job description of what they put together, but they definitely worked closely with us to understand the implications of the work.
Thank you. Next question. Did FCCC have realistic expectations about the progress that families could make in the short term?
I would say they did. What we tended to do in San Antonio was actually allow the foundation to hear family stories and let the families talk about their barriers and talk about some of the goals that they're set to achieve. So we did a lot of telling our information or providing our information to the foundation through families. FCCC and NEKC had the yearly convenings where the communities came together to talk about lessons learned and to work through some of the processes that we did locally in each community. And one of the things that we were able to do was take families with us. So they can hear these parent voices within these convenings as well. So we used a lot of storytelling and actually letting the foundation hear from parents of the initiative.
I would agree completely, but Lakeisha, I would go back to exactly what you said prior to this question. The foundation allowed us to make the program look like how we needed it to look. And that's what we reported out on. The foundation never told us, hey, these measures aren't good enough or this isn't good enough. They took the information that we gave us and then they computed that into what they needed.
I was just going to also point out just the reliance and the central focus on families and individuals' goal setting, I think really helped moderate expectations, because they were, community members and participants were defining for themselves what kind of progress they wanted to make in often kind of a 1-year time frame. But the coaches were very careful about setting smart goals, goals that were, achievable and measurable, realistic, timely, and specific. That wasn't the right order, but you know what I mean. And so I think that also really helped kind of moderate expectations in a way that was realistic from what we observed.
And just to add to what Teresa's saying, and all that was also reported out on. So they were able to see those short-term and long-term goals that these families were setting, along with parent focus groups we used to have. So they were able to hear as a group what the family's goals were as well.
Did any of the programs work with local Head Start programs?
Yes, we did in Buffalo. Initially, when we started, we had a Head Start program attached to us. So yeah, we started off with a Head Start. The partnership it became strained due to their regulations. Head Start has certain regulations that for us, it made it difficult to continue the partnership. So I believe when you think about partnering with the Head Start or any other government agents, government funded, you have to make sure that you have all of the roles defined. Because for us, it was Buffalo Promise neighborhood. So that's the northeast sector of Buffalo. That was our target area. Head Start can target students from anywhere. So it kind of made it a little difficult for us because we wanted to focus on one area. Head Start, being federally funded, can draw their pool from the entire city. Little things like that needs to be worked out prior.
Thank you.
And here, I'm sorry, Burgundy.
Go
And
ahead,
here,
Lakeisha, if you want to add.
yes, just to add, here in San Antonio, our City of San Antonio Early Head Start program is one of the partners of our Dual Generation Initiative.
That will be the last question that we have time for today. Thank you for all of your questions, and hopefully you got what it was that you needed in terms of answers. If you want to continue learning more about family-centered community change, you have a couple of options. You can read the Urban Institute FCCC Context and Equity Reports. They are posted at the Casey Foundation's website. The link is here. You could also read lessons from the Urban Institute about FCCC partnerships. That is also posted on Casey's website. And please stay tuned for the upcoming release of the overall FCCC evaluation and cost study. Thank you for your time today. We appreciate you for joining us, and enjoy the rest of your day.